Step 61, frozen transfer HRT cycles. HRT cycle means hormone replacement therapy cycle, where estradiol and progesterone hormone is given from outside. So what happens is you have menstrual period, then you start your estradiol like Proguanova tablet or estradiol patches. So when you use estradiol, then it shuts down your pituitary gland and you do not produce your FSH and LH hormone, and you do not have a stimulation of your ovaries, you do not produce follicle, you do not ovulate, you do not produce natural estradiol or progesterone. First 10 days you don't do any monitoring. After 10 days you do blood test and scan. You want to ensure that your ovaries is not working. You shouldn't have any large follicle, and your LH should be low, progesterone levels should be low. If you have a large follicle, if you have a increased LH and progesterone levels, that indicates your ovaries not shut down, and that means that your endometrium may be already active and then you need to cancel that cycle. If you don't have a large follicle and your LH and progesterone levels are low, if your endometrium is thicker than 7 millimeters, you assume that the endometrium is ready for implantation, then you start progesterone gel or tablet. 5 days after progesterone, you do embryo transfer. Generally, these cycles are easier to manage because you don't need to do a lot of monitoring, and you don't need to do a lot of blood tests, but they don't have a very high success because here you're replacing your natural hormones with artificial hormones. Your endometrium is not getting all the signals, like LH produced from pituitary is important for endometrium, for luteinization of endometrium. Then like natural estradiol, natural progesterone is important for implantation. Generally these are very easy cycles, but they don't have a very high success like natural frozen cycle, induced frozen cycle, or stimulated frozen cycles.